Yes.
Good afternoon, everyone, and welcome to SCORE's workshop on affordable health care on a lean budget. We're glad you're here. It's a great program if you live anywhere around the Nashville area. And to present it to you is a lovely woman, Ann Lehman Wires from HealthPass at Faith Family. So, Anne, the podium is yours.
Thank you so much. I appreciate SCORE and being here, and Michelle. And Michelle came for a tour of Faith Family Medical Center and to hear more about HealthPass and to give her input. She has amazing, Michelle does, entrepreneurial background, and really appreciate Michelle and SCORE. So I have been in the healthcare space for, oh gosh, 21 years, non-clinical, always with nonprofits. And beyond that, I've been in health and human services nonprofit work. So that is who I am. I have a long career in health and human services work. Now that's relevant because I need you to know I'm not a salesperson. SCORE wouldn't let me on here if I was a salesperson. So what you are hearing is our products that a nonprofit that you'll learn more has created. And again, it's not the sales. It is something that is benefiting employees and employers so that we can serve more people at Faith Family Medical Center. So to that end, I'm going to share my screen. And there we are. So, affordable health benefits on a lean budget. And that is what we're going to talk about today because as entrepreneurs, you probably have a lean budget, understandably so. So I lead HealthPass, which is our workplace health benefit program offered at Faith Family Medical Center. And Faith Family Medical Center has been around for 25 years. We are a nonprofit, and we'll talk about more why that's important to you. If you are a small business trying to support your team's health or even your own, because I certainly have entrepreneurs who are part of HealthPass themselves, in addition to offering it to their employees if they have employees. But it's just difficult sometimes and to not feel overwhelmed by the high cost of health insurance. I hear it all the time. I heard it from a very large organization yesterday. So it's such an issue, and we know that. But we want to share how you can consider offering HealthPass as a way to help with your and your employees' healthcare needs. So there we go. So on your screen is a picture of the Faith Family Medical Center building, and you can see our mission at Faith Family Medical Center. Driven by faith, we provide hope and healing to our hardworking neighbors in need, meaning we serve people who work but do not have insurance or are underinsured. And we serve a few other populations, but primarily we serve people who work but do not have insurance. We provide excellent, affordable, and convenient primary care to those in the Middle Tennessee area. You can see the background of downtown from our building, but to give you an idea of where we're located, we are in the heart of Nashville's medical corridor. We can see Ascension St. Thomas Midtown Hospital. For those of you in around Nashville for a while, it used to be Baptist Hospital. And we can see Centennial Hospital from where we are, if there weren't buildings there. So it's close to both of those to give you an idea. We at Faith Family Medical Center, our clinicians in particular, treat the whole person, providing physical, mental, emotional, and spiritual support and healing. Our model is based on our providers spending more time with our patients to truly know and treat their needs. So you're going to hear lots of differentiators, one of which is, can you believe this, with our initial patients, for our new patients, the initial appointment is 61 hour in length. I mean, it's almost unheard of. Subsequent appointments are 30 minutes in length. So we spend time with our patients, which we can do because we're a nonprofit. We raise over $3 million. We will this year, hopefully well over $3 million, to make things like spending time with our patients possible. So consistent with our mission on the screen, we offer services not found in your typical primary care practice, such as behavioral health or mental health, nutrition coaching, fitness, spiritual counseling if wanted and needed, assistance with medication cost, and chronic disease management days for those with hypertension or diabetes. We believe at Faith Family Medical Center that healthcare should be affordable, accessible, and delivered with dignity. So HealthPass is one way we live out Faith Family's mission. And quite honestly, we developed it so we could serve more patients. But in the meantime, small businesses are very much able to have this amazing offering to their employees. We all know that the current health insurance system creates real challenges for small businesses, as I said earlier. And really, the current health insurance system wasn't designed with small employers in mind. So that's very difficult from the get-go. For employers, the costs are often unsurmountable. And for employees, especially part-time workers or 1099 contractors, healthcare can feel out of reach. So HealthPass was created to bridge that gap. Now, I'm going to say this at least once, if not many more times, because our attorneys require it. HealthPass is not health insurance. It's not health insurance. HealthPass is not health insurance. So let's take a look at some of the numbers so we can just do some comparison. Last year, the average employer spent $702 per month to cover a single employee with traditional health insurance. The employee still paid, on average, $140 per month themselves. And these amounts have significantly increased this year, and we know they're already increasing for next year, 2026. So the good news is that now giving employees access to health care they deserve has gotten easier. At only $20 to $50 per participating employee per month, HealthPass is less than 10% of the cost of traditional health insurance plans. It bridges the gap so that you can offer some health benefits to your employees. HealthPass is adaptable, simple, and meaningful. It helps attract talent, so you can use it when recruiting new hires. Certainly helps retain your employees, and most importantly, you have a healthier workforce, both physically and emotionally, behaviorally, mentally. But guess what? HealthPass is not health insurance. So through HealthPass, unlimited primary care visits, either in person or via telehealth, for a $10 copay are available through HealthPass. HealthPass also includes behavioral health visits and resources, an annual wellness exam or physical, a free annual flu shot, free access to our Journey to Wellness events and services, discounted diagnostic services like x-rays, MRIs, and CAT scans, deeply discounted, specialist referrals when needed, discounted dental, vision, hearing aids, and durable medical equipment, counseling and employee assistance options, and some of the benefits, which I'll tell you which ones, extend to spouses, domestic partners, and dependents. So, for uninsured employees in particular, this kind of care can be life-changing. So our employees are living healthier lives to increase productivity and loyalty if they use HealthPass and tap into the services. Who we serve, and Michelle said some of this, and I said a little more, but let's talk about it more detail. Oops, sorry about that. The in-person care that I mentioned is provided at Faith Family Medical Center, and we have the one location that I described. But we have patients actually more than just the Davidson and the contiguous counties. We have patients that travel from 31 of the 33 Middle Tennessee counties. Our care is that good. We have patients who even drive from Southern Kentucky or Northern Alabama to come to us. Amazing. But that speaks to our how well we do. We certainly offer telehealth to make it easier and more convenient. And our HealthPass portable product is available throughout the United States. A little teaser as we talk about the three products. So here's the important facts as we talk about the products. When I share the amount, I want you to know that it's per participating employee per month. Participating employee per month. You do not have to pay for all of your employees to participate. You only, pay for those who choose to participate. And in fact, we have nearly 40 HealthPass business and nonprofit partners. Most employees do not participate in HealthPass because they have health insurance elsewhere through their spouse, domestic partner, through the exchange, other ways. Or they're the young invincibles. They don't think anything's ever going to happen to them, so they don't sign up. So typically only a portion of employees sign up for HealthPass, and that's important for budgeting, obviously. And here's another way that HealthPass is flexible. You, as the employer, choose what you want to offer and to whom you want to offer it, which of your employees you want to offer, which groups of employees. So I'm sharing this, 4 years now since we began HealthPass. I've been sharing this amazing news, and sometimes I get a look, and this look is very interesting. And finally, after several of these occasions of this look, I asked a friend that I was sharing, HealthPass, and I'm like, what is that look? I see that look from other people. And they're like, Ann, this is too good to be true. It just can't be. I'm like, well, it's true. It is absolutely true. And I think because the prices are affordable and because people, of course, burnt in the past, there's a distrust often with healthcare anyway. So just know it's true, it's true. And one reason is because Faith Family Medical Center is a nonprofit organization. I've said that for a couple times now. Our mission, as I said, is to improve people's health. We raise that money so that it does not cost as much for our patients to come to us. The last I heard, and it's certainly gone up, it cost us about $242, maybe $250 per patient visit. It cost us that much. But we raise the difference so that it's affordable for our patients, because that's what we're here for. We're not here to make a profit. So let's talk about the 3 HealthPass plans. The first one is HealthPass Primary, which we've talked about some of this. The primary care visits, it's $38 per participating employee per month. The copay is $10 when our patients come in to see their providers. So that's copay. And that copay of $10 includes many provider-advised labs. How about that? Amazing. So your employees would be able to come to Faith Family for these convenient primary care options, preventative services, to come to Faith Family. But it also includes access to our, as I said it earlier, our full-time psychiatric nurse practitioner for that $10 copay who can diagnose, prescribe medication if needed, and work with the patient to make sure the medication is working well. She does some counseling, but she certainly refers out to counseling centers or counselors based on the need and the ability to pay and what language the patient speaks. She does refer to counseling beyond what she provides. So that's important. You see on there, and I haven't talked about this one yet, pharmacy or prescription assistance. That is available to patients who qualify, to our patients who qualify, and most of our patients qualify for prescription assistance. Nearly $5 million of free medications were given to our qualifying patients last year. The patients pay a $5 pass-through fee so that they have a little skin in the game, but virtually free. And also, HealthPass Primary includes free access to our Journey to Wellness programming. And get this, everything that's done in Faith Family's Journey to Wellness program is free. Free. It teaches, Journey to Wellness teaches patients to live healthy lives through wellness counseling, nutrition education, personalized exercise plans, disease management days, and more. So that too is really distinguishes us from other primary care providers. And all of this for just $38 per participating employee per month. The next product is HealthPass Portable at $20 per participating employee per month. And as you can read there, it is a nationwide access to what's available through Portable. So the benefits are, and you can see with a little asterisk, this is available at no extra charge to the member's spouse, domestic partner, and dependents. HealthPass Portable is available at no extra charge to the spouse, domestic partner, and dependents once that employee is paid for it, the $20 per participant, as they participate per month. So let's talk about a little bit. You'll want to know a little bit more. Okay, but tell me more about where they can go, what they can do, they being your employees. There are over 262,000 available dentist practice locations nationwide. And in most instances, members save 15 to 50% per visit. Specialty dental care, such as orthodontics, periodontics, are also included. So that's dental, little brief snippet. For vision, there are 20,000 vision providers nationwide who participate in this program. Members save 10 to 60% on glasses, contacts, laser surgery, and exams. And examples of participating chains are Lens Crafters, Pearl Vision, VisionWorks, JCPenney, Target, and more. So that's amazing. Teladoc is also included in HealthPass Portable, and you may have heard about it. I'll share a little more. Through Teladoc, board-certified doctors are available 24/7, 365 by phone or online video, anytime, anywhere for general medical issues. The doctors through Teladoc offer a diagnosis, treatment options, and prescription if medically necessary for a $15 copay. That's Teladoc. There's also, through the Telephonic Employee Assistance Program, it's a way to help your employees cope with life's ups and downs. So there's professional counseling through this Telephonic Employee Assistance Program. It's also to work through just needs that like I am over my head in debt. I don't know what to do with this credit card debt, for example. Well, through the Telephonic Employee Assistance Program, they have trained people who can give ideas of how to get out of debt and how to have a budget, stay out of debt. One example of what can be done through the Telephonic Employee Assistance Program, in addition to some counseling, all confidential, of course. And as you can read, discounted hearing aids, discounted durable medical equipment, and also included HealthPass Portable. The third product is HealthPass Premium, and that's a combination of HealthPass Primary and HealthPass Portable for the discounted rate of $50 per participating employee per month. So it includes all of that we talked about from Faith Family Medical Center that we discussed through HealthPass Primary. And most of what's included in HealthPass Portable, we've upgraded from the Telephonic Employee Assistance Program to more counseling services. So these counseling services can help 24/7 for an assessment, then schedule up to 6 sessions per year via phone, virtually, or in person, or a combination of those. So you can see, of course, HealthPass Premium is the most comprehensive and the most cost-effective option. Now here they are, side by side. Do you have any questions at this point? Okay. So I want to share with how flexible, these are just some examples. You can always say, well, Ann, can we do this? I might have never heard that idea before, but the answer could be yes. So these are just some ideas and what other HealthPass partners have done. You are not locked into long-term contracts. Do we have agreements or contracts? Yes, because our attorneys make us, and that's good. But they are not long-term contracts. Very easy, very flexible. HealthPass is paid on a monthly basis. You can offer the employees all 3 of the plans, Portable, Primary, Premium. You can offer all 3 of them. Or you can offer just one of the plans to your employees. You decide. You control what you offer. And here are other ways of what our employers have done. They've had their employees pay a portion of the monthly membership fee. Up to you. You let the employees decide which of the 3 products they want or need. And you can tier it, so you can base it on the number of hours that are worked. So you can decide, or length of service. That's entirely up to you. Okay. Pausing again. Any questions?
And I don't have any employees. Can I sign up?
Oh, Michelle, that's a great question. So you're a solopreneur? Yes,
ma'am.
I have several solopreneurs that have signed up. Number one, so that they, if they need it, can become a part of HealthPass. I have several of those. And number two, even if they don't need it, the solopreneur, if they don't need it, they want it as they look toward hiring employees. And I think this is interesting. I just had a meeting with a large employer yesterday and others. You know, there's no cost to offer HealthPass. You just sign up and say, okay, Ann, I want to be able to offer HealthPass to my employees or future employees. You sign up for that. Well, until someone signs up, you don't have to pay anything. You just have it available in your arsenal to offer your new hires. Use that for recruiting. So I think that's important to realize too. So yes, Michelle, yes, you can. And I have several solopreneurs who have signed up, and they have signed up, but they're also in anticipation of eventually hiring people. So I shared this, but I'm going to share it again. We have helped nearly 40 businesses and nonprofits so far. I love this statistic. The only companies that have rolled off are because they moved back to California. I can remember one of those, or moved to Memphis. One of them did, so they're no longer close. Or they started offering their employees insurance, health insurance. We don't mind being a stepping stone at all. So those, other than that, we've retained our businesses that have participated. And as you can imagine, but state it anyway, the types of partners we have vary greatly. It's landscaping, construction, restaurants, childcare centers, farmers, or a farmer. I'll take farm. No, two. We do have farmers, housekeeping services, a composting company here in Nashville, and so many more. So it's so many that keep Nashville running. So those are just some examples who we currently serve. So if you would like to discuss HealthPass further, the first step is to contact the HealthPass team, and we can schedule an introductory meeting. And the contact information is on your screen. Love to do that. And we can talk about your business and your needs, and then we can personalize an affordable solution that's just right for you and your business. Love to do that. Again, remember, lifetime of career in nonprofit work. So I am not not a high pressure salesperson by any means. Not comfortable with that. So please don't worry about that. I mean, if you want to just explore, I'm your girl. Okay. Yes. So contact me, and there I'm again. Let's bring hope and healing to your team. I love to give tours. I've given lots because I love it. And often when people seeing is just like, wow, when you come to Faith Family. So please, I would love to give you a tour if you would like. That'd be my honor. And what else? Can send you information, answer any questions. So certainly more time if anybody has questions. If Michelle, she is really learning about HealthPass if she has any. But I want to thank SCORE for allowing us to provide information about HealthPass. Thank you so much. And thank you, Michelle.
Well, thank you, Anne. You always do such a great job of describing the services. And the facility is wonderful. It is top of the line. Everything is, what am I trying to say? The latest of the greatest of the equipment. The employees are so friendly and wonderful. So you really do owe it yourself to contact Anne and at least go down and see where the facilities are. So again, thank you. And thank you for attending. If you are interested in our future webinars, please go to score.org/Nashville. You can click on take a workshop, and everything that we have scheduled will be up there where you can see it. And please visit frequently because I'm adding workshops all the time. Let's see, we have a question. Is this available in every state, and also are PPO plans available? I don't think she heard that this isn't insurance.
Right. What was the first? Are they available? I didn't miss that first part.
Are they available in every state?
Only the HealthPass Portable. Only the HealthPass Portable is available nationwide. And yes, Michelle, that's right. It's not health insurance, so it's not health insurance, so no PPO because it's not health insurance. But thank you for the question. What other questions? Oh, come on. Surely you all, I found if somebody has a question, then others do too. What else? Okay.
Well, you've got a number of thank yous. So, Anne, they'll think of things and they have your number and they can contact you. So thank you so much. Thank you for attending, and we'll see you later on Zoom.
Thank you
Bye.
all.